What is the exact monetary value of a human life? If you ask 10 different countries this question, you will get 10 completely contradictory answers. In some places, a life-saving heart surgery won't cost you a single penny, but you might have to wait 2 years to get it. In others, you can see a world-renowned specialist within 20 minutes, but the bill might literally bankrupt your entire family. Some systems are designed to cure you after you collapse, while others send a doctor to your house to make sure you never collapse in the first place. Today, we are traveling across the globe to decode the healthcare systems of 10 major countries. We'll look at the brilliant medical strategies, the glaring structural flaws, and the cultural secrets that define how the world stays alive, the United Kingdom. Let's start by looking at a country that treats healthcare not just as a public service, but as a literal national religion, the United Kingdom. To understand the UK, you have to understand the NHS, the National Health Service. Born out of the rubble of World War II, the NHS is built on a radical, uncompromising philosophy. Healthcare should be entirely free at the point of use, for everyone regardless of their wealth. In the UK, you don't get a medical bill. You have a baby, free. You get cancer, free. You break your leg in 3 places, free. The system is funded entirely through general taxation. However, the utopian dream is currently colliding with a harsh demographic reality. The UK has an aging population, and the NHS is severely underfunded and buckling under its own weight. The glaring flaw here is the wait times. It is not uncommon for Britons to wait literally months for an MRI or hours for an ambulance to arrive during a crisis. The system guarantees that everyone gets a slice of the pie. But right now, the pie is shrinking and the doctors are exhausted, frequently going on strike just to secure a living wage. Just across the ocean, Canada looked at the UK model and tweaked it into something called a single-payer system. In Canada, the government does not own the hospitals or employ the doctors like the UK does. Instead, the doctors are private, but the government is the only entity allowed to pay them. It is actually illegal in Canada to buy private health insurance for basic medical care. Culturally, Canadians view their healthcare system as the ultimate equalizer. They pride themselves on the fact that a billionaire CEO and a minimum wage worker must sit in the exact same waiting room to see the exact same doctor. There is no cutting the line with cash. But just like the UK, the Canadian system suffers from rationing. Because healthcare is free, demand is limitless, but supply is not. Canadians routinely suffer some of the longest wait times in the developed world for elective surgeries, like knee or hip replacements, sometimes waiting over a year just to get into the operating room. The United States. And if you want to see what happens when you completely eliminate wait times by turning healthcare into a hyper-capitalist enterprise, you look south to the United States. To understand the American healthcare system, you have to understand one fundamental rule. It is the most expensive machine in human history. The US spends more per capita on healthcare than any other nation on Earth, yet leaves roughly 25 million of its citizens completely uninsured. Unlike the rest of the world, American healthcare is deeply tied to employment. If you have a good job with great insurance, you have access to the greatest, most technologically advanced medical care on the planet. If you need a cutting-edge experimental cancer treatment or an MRI tomorrow morning, America is where you want to be. The financial incentives mean the US is a global engine for medical innovation, developing the vast majority of the world's new drugs and medical devices. But the cost is catastrophic. The US is the only developed nation where medical bankruptcy is a common occurrence. A single trip to the emergency room can saddle a family with tens of thousands of dollars in debt. Critics argue the American system is a sprawling, middleman-heavy corporate bureaucracy that views patients as profit centers, punishing the poor and sick while heavily rewarding pharmaceutical companies and insurance executives. Germany. So is there a way to balance capitalism with universal coverage? To find out, we have to travel to Germany. Germany invented the modern healthcare system. In 1883, Otto von Bismarck created the sickness fund model, and it is a masterpiece of balance. In Germany, you are legally required to have health insurance, but it isn't run by the government. Instead, there are over 100 non-profit sickness funds. You and your employer split the cost, and the premiums are based strictly on a percentage of your income, not your health risks. The rich pay more to subsidize the poor, and the healthy subsidize the sick. Because multiple funds are competing for your business, the service is fast, efficient, and highly responsive. You can choose any doctor you want. It's a multi-payer system that acts like a public system. It works beautifully. Though critics note that it is incredibly expensive to maintain, taking a massive chunk out of every worker's paycheck. Switzerland. If Germany is a balance, Switzerland is an extreme paradox. They have achieved universal healthcare using a strictly private capitalist model. In Switzerland, there is no free government healthcare. Every single citizen is legally mandated to go into the private market and buy health insurance. So why isn't it a chaotic, bankrupting mess like the US? Because the Swiss government regulates the insurance companies with an iron fist. Insurance companies are legally barred from making any profit on basic healthcare. They cannot deny you for pre-existing conditions. And if you are too poor to afford the monthly premium, the government steps in and pays it for you. The result is a system with spectacular quality, immaculate hospitals, and virtually zero wait times. The downside? It is eye-wateringly expensive. The out-of-pocket costs and deductibles for the average Swiss citizen are incredibly high, meaning you only go to the doctor when you truly need to. Japan. Now let's fly over to Asia and look at a country that completely solved the cost problem through ruthless government price controls. Japan. Japan operates on a system of hyper-efficiency. Like Germany, everyone is required to buy into a health insurance plan. But what makes Japan entirely unique is the fee schedule. Every 2 years, the Japanese government sits down and dictates the exact price of every single medical procedure, drug, and device in the country. And the prices are astonishingly low. An MRI in the US might cost $2,000. In Japan, it costs about $100. A night in the hospital costs less than a night in a cheap hotel. Furthermore, Japan has no gatekeepers. You do not need to see a general practitioner to get a referral. You can walk directly into a specialized clinic for a brain scan on a Tuesday afternoon. Because it's so cheap and accessible, the Japanese go to the doctor roughly 13 times a year, 3 times as often as Americans. The flaw? The system is slowly crushing the doctors. Japanese physicians see so many patients a day that visits often last exactly 3 minutes. And with Japan's massive, rapidly aging population, the government is desperately trying to figure out how to keep the system financially solvent without bankrupting the youth. South Korea. Just across the sea, South Korea has taken Japan's high-volume model and injected it with dizzying state-of-the-art technology. South Korean healthcare is defined by a cultural concept called pali, which translates to hurry, hurry. The National Health Insurance Service is a single-payer system that is so deeply digitized that your medical records are instantly available at any clinic in the nation. It is fast, cheap, and boasts some of the highest cancer survival rates on Earth. However, South Korea is currently dealing with a bizarre and fascinating crisis. The free market is cannibalizing essential medicine. Because the government keeps the prices for essential procedures, like pediatrics, emergency surgery, and obstetrics, so low, doctors make very little money saving lives. So thousands of doctors are fleeing essential care to open highly lucrative, unregulated cash businesses, specifically dermatology and plastic surgery. South Korea is the plastic surgery capital of the world. But if you have a child who needs a pediatrician in the middle of the night, you might find the emergency rooms completely empty of staff. China. While South Korea struggles with doctor distribution, China struggles with something else entirely. Sheer, unfathomable scale. How do you provide healthcare for 1.4 billion people? In China, the system is deeply centralized around massive, state-run Tier 3 mega hospitals located in major cities. In rural areas, village clinics handle basic issues, but there is a deep lack of trust in rural medicine. As a result, when someone gets sick in China, they immediately travel to the major city hospitals. These hospitals are incredibly chaotic, seeing up to 10,000 patients a single day. The lines are so long that a black market of hospital scalpers exists, people who literally buy up doctors' appointments and sell them at a massive markup to desperate patients in the lobby. Interestingly, China operates a dual medical system. In the exact same hospital, you can be prescribed cutting-edge Western chemotherapy and then walk down the hall to be prescribed traditional Chinese medicine, like herbal remedies and acupuncture, which the government heavily subsidizes and promotes as an equal science. India. India shares the immense scale of China, but adds a layer of staggering economic disparity. India's healthcare system is a world of 2 completely different realities. On one hand, India is the global capital of medical tourism. They have elite, private, hypermodern hospitals staffed by English-speaking, Western-trained surgeons. A heart bypass that costs $100,000 in the US can be done in India for $5,000 with luxury hotel-like service. But that is for foreigners and India's wealthy elite. For the bottom 50% of the population, the reality is stark. Public hospitals are heavily underfunded, severely overcrowded, and lack basic sanitation. While public care is technically free, patients often have to go out and buy their own bandages, syringes, and medicine before the doctor can treat them. Because public care is so under-resourced, over 70% of healthcare in India is paid out of pocket in private clinics. To combat the massive poverty this causes, the government recently launched Ayushman Bharat, dubbed Modicare, the largest government-funded healthcare program in the world, aiming to provide free coverage to the poorest 500 million citizens. It is an incredibly ambitious attempt to fix a deeply unequal system. Cuba. Finally, we travel to an island that has virtually no money, heavily restricted access to modern medical technology, yet boasts a life expectancy equal to the United States. Cuba. The Cuban healthcare system is entirely state-run, deeply socialist, and operates on one obsessive philosophy: extreme prevention. Because of historical trade embargoes and extreme poverty, Cuba cannot afford expensive MRI machines, advanced surgical robots, or sometimes even basic antibiotics. So they decided the only way to survive was to make sure their people never get sick in the first place. In Cuba, there is a doctor and a nurse assigned to almost every single neighborhood block. They do not wait for you to come to the clinic. They actively knock on your door, walk into your living room, check your blood pressure, ask about your diet, and inspect your home for mosquito breeding grounds. Healthcare is viewed as a total community effort. The system produces brilliant, highly resourceful doctors. So many, in fact, that Cuba's biggest export is actually medical professionals, whom they send all over the world to work in disaster zones. The glaring downside is the crumbling infrastructure. Patients often have to bring their own bedsheets and food when admitted to a hospital, and the lack of specialized medications is a constant, quiet tragedy. Conclusion: a country's healthcare system is essentially a mirror. It reflects a society's deepest fears, its greatest hopes, and its ultimate values. The UK values absolute equality. America values hyper-innovation and individualism. Canada values shared communal experience. Germany values social solidarity. Switzerland values regulated capitalism. Japan values affordable efficiency. South Korea values technological speed. China values mass scale. India struggles with the divide between global excellence and crushing poverty. And Cuba values grassroots prevention over technology. None of them have the perfect answer, because there is no perfect way to cheat death. Every advantage comes with a distinct cultural tax. You can have it fast, you can have it cheap, or you can have it great. But no country on earth has figured out how to give you all three. But I'm curious, now that you've seen the spectrum, if you were to get sick tomorrow, which of these 10 systems are you choosing to save your life and why? Let me know down in the comments.